I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU, Radio Hofstra University, to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Today we'll be discussing alcoholic liver disease, an old problem that really never went away and is in some ways more problematic than ever. My guest is my friend and colleague, Dr. David Bernstein. Dr. Bernstein is Chief of Hepatology and the Director of the Sandra Atlas Bass Center for Liver Diseases at Northwell Health. He's also a Professor of Medicine and Education Science at the Zucker School of Medicine at Hofstra Northwell, and I'm delighted to have him on the show today. David, welcome to Well Said.
Ira, thank you so much for having me.
So I'd like to start with some basics. I'm sure that many of our listeners have heard that drinking alcohol, especially to excess, can lead to liver disease. But before we get to how that happens, can you start by describing what the liver does under normal circumstances?
Absolutely, Ira. So, the liver is the largest organ inside the body, sitting up there, right below the lungs on the right side. It really has two main functions. It's a factory and it's a filter. So, as a factory, it makes things, and it produces many of the proteins and other compounds that really are involved in digestion and clotting. And so it's very important in that way. In addition, as a filter, it functions to clear out medications, breakdown products of medications, and toxins from the blood. And there's only one of them. So it's really important that we try our best to protect it because we need all of these functions to survive.
Just to clarify one thing, when you say clotting, you're talking about blood clotting?
Absolutely. So there are many factors that are made proteins that are involved in the clotting process. So you cut yourself and your body is able to stop itself from bleeding. Almost all of those proteins are made within the liver. So if the liver isn't working, people tend to bruise easily and will bleed.
This function as a filter, I guess that's more relevant to the conversation we're going to have about the effect of alcohol on the liver. I want to just explore the effect of alcohol on the liver in the context of what you just said about what the liver normally does. So what's the role of the liver in response to alcohol consumption or having a drink?
Sure. So the liver is, one of the organs and probably the major organ, which is involved in the breakdown of alcohol to its different metabolites. So to essentially make it non-toxic and to allow the alcohol to be broken down and not cause a problem. And it's pretty good at what it does. If you don't overload the liver, it does a really good job. And so that's its main function, as regards to alcohol.
And I'm sure most of us are aware of the fact that some people seem less affected by alcohol than other people. Is that a reflection of different efficiencies of people's livers, or is there more at work here?
So there are a lot of factors as to why some people tolerate alcohol more than others. And we really have to think of it in two ways. One is the classic, I can take a drink or two and I don't feel anything. And that's really not usually a liver issue. That's a function of absorption of the alcohol and going into the brain and causing some, symptoms that we think of as, slurred speech, drowsiness, headache, and the like. As regards to the liver, there are some people that with small amounts of alcohol over time can develop significant disease, and there are people who can drink what we would consider a lot, case of beer, for example, every other day or so without having a problem. And there are lots of sort of reasons, why that is. One is simply genetics. There are some people that are predisposed to develop liver disease from alcohol. Smaller people, are more likely to have a problem related to alcohol. Women are more likely to have that because, one, they're smaller, and two, they tend to have a greater fat content than muscle content, than men, and those with lower muscle contents and higher fat contents are more likely to have liver disease because they're less likely to absorb the alcohol into the blood quickly and then, pass it on to the liver. So those are some of the factors that you can't control. There are some factors that you can control, and we may get into that a little bit later.
Okay, let's get into it right now. So is there a amount of alcohol that is okay, safe, or maybe even beneficial?
It's easy to answer the second question first. There isn't an amount of alcohol that's beneficial. Alcohol really doesn't do anything positive for us from a medical standpoint. May take away some inhibitions, and people may be happy in certain social situations. But medically, there's really nothing good about alcohol.
I'm going to stop you there as a cardiologist.
Okay.
There's been a sort of longstanding debate in the cardiology community about whether small amounts or modest amounts of alcohol might actually protect against certain kinds of heart disease. Do you buy that?
So I think that's a controversy, and I know exactly what you're saying. There have been some studies that say 2 glasses of red wine a night may be protective against underlying heart disease. I don't know that's ever been proven. I think that those studies are a little bit older, and recently we've had a lot of data that shows as little as 1 glass of alcohol a day in men or women can have other effects that are deleterious to people. So here, the typical, patients love the cardiologist because they say have some wine, and they really don't like the GI or the liver doctors who say, you really should put a hold on that. And so differences of opinion based on specialty, I think
Sure.
we're a little bit biased because, we see so much of this, unfortunately.
Yeah,
right now.
but even in terms of liver disease, is it the case that any alcohol consumption is associated with potentially negative outcomes, or is there some sort of threshold effect here?
I think it's really important to get across that 99% of people who drink alcohol never have a problem in their liver related to it. There are these other factors that we're not so sure of as to why. In general, and it's really general, there typically isn't harm if you're having about 1 glass of something in an hour or more, not having more than a couple of drinks, in a given day, and not doing it, every day. So in moderation, alcohol is fine, and I think that's a very important point to get across. If you think of how many people drink alcohol, if it caused problems in everyone, we'd have an even bigger epidemic.
Right, fair
that
enough.
we currently do. It really has to do with people who I will say, and I don't want to use the word abuse, but drink a lot more than perhaps they should.
I'm going to ask you a question that I know is difficult to answer, but I think it's a question that comes up a lot, which is how much is too much, right? So you said maybe a glass here and there is fine, but what would you characterize as a dangerous or deleterious amount of drinking?
Yeah, and so that's actually been described, and again, it's constantly changing. People who binge drink, are at risk of significant disease, and binging is generally defined as more than 5 glasses of something in the course of one day. People who drink more than 2 glasses of something a week, I'm going to just stick with wine because it's easiest, I think, just to visualize. More than 2 a day, every day, is a risk. And I think it's also, quite frankly, Ira, it's dependent on the size of the glass.
Yeah,
right?
sure.
And so if you go out to a restaurant, and restaurants make their money on alcohol, and you get a bottle of wine, usually it gets emptied in about 4 to 5 pours. So in fact, each one of those glasses is probably 2 to 3 drinks. And so you just have to put it in, perspective. There are a host of organizations now that will recommend, no more than 1 glass, per night. But again, it's truly dependent upon, the size of that glass. Even having said that, most of the people who drink like that won't develop issues related to chronic liver disease.
And you mentioned something about the pattern of drinking in addition to the amount of drinking. Could you clarify that a little bit?
Yeah, sure. So people who don't drink much but go out and, binge, your classic college students, if you will, they're less likely to have chronic liver disease. They can have acute liver disease. So they go out and they have, their binge, and they can get alcohol poisoning. They can develop liver failure, related to what they drink. In particular, if they have a headache, and take some Tylenol all with that. Because when you drink a lot in a short period of time, you overwhelm the liver's ability to break down the alcohol, and then the toxic metabolites of alcohol, can have deleterious effects in the liver and other organs. In people who drink regularly, they tend not to have this acute liver failure. They develop usually a fatty liver to begin with, and that can progress on over time because of inflammation to scarring, and even cirrhosis. And once they develop cirrhosis, then if they drink, they're at risk of what's called acute alcoholic hepatitis. So there's a real difference in the evolution of disease depending upon how much you drink in what period of time.
I do want to get back to talking about those different kinds of effects that you laid out for us, but you mentioned something really important that I don't want to pass without comment, which was the addition of Tylenol. Could you just comment on that as it relates to the liver?
Tylenol itself is safe when used in the regularly prescribed dosages. So, for example, we give patients with advanced liver disease and cirrhosis Tylenol all the time because it's safer than some of the other nonsteroidals like Aleve or Advil. But when Tylenol is used with alcohol, the alcohol actually potentiates the hepatotoxicity or the liver damage that Tylenol can cause. So it's not uncommon for someone to have some drinks and then take standard dose of Tylenol and develop significant liver injury, most of which reverses over time. But the combination of Tylenol and alcohol is unsafe. Tylenol itself in patients with advanced liver disease is actually very safe, provided you don't take, way too much.
Yeah. So you mentioned a whole bunch of different kinds of liver diseases that are associated with alcohol consumption. Can we just go back a little bit and separate what you said were the acute effects from the sort of longer term effects of heavy alcohol use?
Sure. So if someone just drinks a lot and doesn't really drink much, so they go out on a weekend and have a binge, those people tend to have what's considered more like an alcohol poisoning. And so they can develop very high liver tests because there's some sort of acute injury. But usually that will get better, provided they don't have any sort of underlying liver disease from something else. And most people don't. And so we're, quite frankly, less concerned about the liver in someone who goes out and binges, once or twice, as opposed to someone who drinks far less but more frequently, and over time goes on to develop significant liver injury.
And for those who do go on to develop liver injury from more chronic drinking, is there a kind of progression of, does it go through certain stages, and what does that look like?
It absolutely goes through stages. So the first thing that someone would notice if they were evaluated by someone in medicine would be that they developed fat within the liver. And usually, that's determined by some mildly elevated liver tests and an abdominal sonogram, which looks at the liver. Over time, and no one knows what that time is, and it's dependent upon how much someone drinks, they develop scarring. After scarring, they develop what's called cirrhosis, which means that the liver has gone from looking smooth like you'd see in the supermarket to lumpy bumpy. Right? Uh-huh. You're not going to buy a liver at Stop and Shop that looks lumpy bumpy. You want that nice, smooth, soft thing. And that takes most of the time many years to develop, although in thinner women, for example, that can happen in as short as a year, depending upon alcohol intake. Once someone has developed cirrhosis, it sort of puts them in a different class of disease. They're at risk, if they keep drinking, of liver failure. They're at risk of liver cancer. They're more likely to need a liver transplant. And now that we've cured hepatitis C, cirrhosis from alcohol is the number one reason why people in the United States need a liver transplant.
And at which stage among those that you just described, is this still reversible if somebody stops drinking?
At almost all stages, this is potentially reversible. So I've seen people that have come in with decompensated liver disease, so they're all yellow. They have some fluid in their belly called ascites. And if they stop, it's very possible that they can recover. So we usually use the following. If someone has cirrhosis and they stop drinking, about a third of people over time, and it may take years, the liver will recuperate, it can regenerate and be fine. About a third of people will remain the same, and about a third of people will progress even if they do stop, which means that 2/3 of people will actually do fine if they stop drinking. If they don't have cirrhosis and they stop drinking, almost everyone will reverse to a point that the liver functions normally and they don't have to be concerned long term. So, once again, we used to describe cirrhosis as irreversible damage. We now know that it isn't. And if you take away the stimulus, in this case alcohol, many people will recover and go back to normal. They just can't drink ever again, but they do well.
Yeah, that's interesting because I certainly remember the teaching that cirrhosis was kind of the end game, that once you had that, you were not going to get better. That's interesting that that's no longer.
No, that's changed. So we now describe cirrhosis as a dynamic, not a static process. And we've learned that once you get rid of the stimulus, the liver can regenerate and become non-cirrhotic. So we see that in conditions such as hepatitis C that you can cure, hepatitis B that we can suppress, and alcohol if people stop drinking.
Really interesting. I mentioned in the intro that alcoholic liver disease is a problem that's both old and new. I mean, old in that it's been around probably as long as alcohol's been around, but new because of newer patterns of drinking. Could you talk to us a little bit about that?
So what we have seen as a consequence of the COVID pandemic has been a dramatic increase in the amount of alcohol that people have been taking. That's across all races, genders, and socioeconomic classes. So much so that within our system, Northwell, and across the country, the hospital admissions for alcohol-related liver disease in the past 2 years have gone up over 400%.
Wow.
And we continue to see this. And interestingly enough, it's mostly in young people. And when I say young people, people in their 20s, 30s, maybe their 40s, it's about equal between women and men. And one thing we do know is that alcoholic liver disease in women is underdiagnosed. It's just not discussed for unclear reasons. But in particular, our area, Northwell, we are seeing an epidemic of alcoholic liver disease in women. And many of them are now coming in being evaluated for transplant because they've been staying home and drinking a glass or two of wine a night, so not someone you would think has a problem, with their friends at lunch or their friends at dinner. But since women are predisposed to develop liver disease from alcohol, based upon their size and other factors we talked about, I think this is really a new pattern, and it's important for us to recognize that and to try to get the word out to both people in the community and physicians in the community and other healthcare providers, of the importance of asking about it. Because most people think if you have a glass or two of wine a night, it's nothing. And the reality is for most people it is nothing. But for some people it's something.
And do you think that failure to recognize or failure to diagnose is because that level of drinking is generally not seen as excessive, or that these individuals really don't show any outside evidence of having something wrong with their liver?
I think it's both. Most of these people don't show that there's a problem until there's a problem. Right? And so they're coming along, and then all of a sudden they have something that causes them to decompensate. They bleed, they develop ascites, they're diagnosed with cancer, and then you sort of look back in that retrospectoscope to say, hey, there may have been a problem all along. The second is, as you said, drinking a glass or two of wine a day is not considered to be drinking too much for the most part. Society accepts it, as you mentioned earlier. The cardiologists encourage it. And so, right, so, there's this risk. Now, again, having said this, the vast majority of people never do have a problem, but some do. I think what's inherent in what we've just discussed is there aren't any good tests to determine if someone has a problem with the liver until something occurs, meaning there isn't just a blood test you can send. There isn't a specific diagnostic test that you really can do. And most people feel fine up until they have a crisis. And that's sort of the silent epidemic and problem related to liver disease.
Well, yeah, so I was going to ask you about that. So is it the case that people can sort of hide, and I don't mean that in the deliberate sense, but kind of not have evidence of a significant problem with their liver, even though they may be doing significant damage?
So I read that's the vast majority of people. Most people are going along and, they may have fat in their liver, they may have cirrhosis. They don't know until all of a sudden they look in the mirror or someone they're with says, hey, you look a little yellow. All of a sudden their belly seems to swell up like they're pregnant and there's fluid. They present with vomiting up of blood. And it's taken years to reach that point, and there would have been no indication that this was brewing inside. And that's the concern. And since we don't ask a lot about liver disease when people go to the general doctor, and I'm not saying that we should change completely what we're doing, but this comes from sort of the history. I think we have to recognize that asking about alcohol is important, and then discussing with people the potential risks are important, and then follow. But I don't think you can say, hey, everyone who drinks needs to be assessed for this, because that's not the case.
Right,
again,
but
the vast majority of people are fine.
Yeah, but I can imagine you have sort of a tough hill to climb there. If people feel fine, look fine, and most people do well, to say, hey, your 1 or 2 glasses of wine a day may be putting you at significant risk. I can imagine that that's a difficult sell to a lot of patients.
It absolutely is. But I think that sell is, if you want to use the word sell, is dependent upon who they're actually visiting. By the time they get to me, the liver doctor, they know they have a problem. So these discussions really need to be with the primary care provider, whether that be a family practitioner or a general internist, an obstetrician gynecologist, where people get this, sort of primary care and have those discussions. But it's going to be very difficult, because once again, it takes a long time to develop a problem, and most people feel fine and all their tests are fine. And so I'm biased because I see a skewed population.
Sure.
By the time they come to me, everyone says, fine, I'm not going to drink anymore. And half the time they don't, and half the time they do. But it has to start way earlier than the specialist.
I just want to clarify one other point, which is that you mentioned a couple of times as an indicator of significant liver disease that people's skin tone turns a little yellow, or sometimes pretty intensely yellow. Could you explain the connection there?
People turn yellow because there's an increase in a chemical that's called bilirubin. The liver is involved in the metabolism or breakdown of bilirubin, and also when liver cells die, the bilirubin that's inside of the liver cells go into the bloodstream. So there's a direct correlation between liver damage and turning yellow, and we can actually measure that. There are other things that cause the bilirubin to go up. If there's a blockage, like someone has a gallstone, that passes. But when people turn yellow, the first thing one thinks about is liver disease. It's a bad sign when someone turns yellow from liver disease if it's chronic, because it tells you that there's been a lot of damage over time. But there's still people who will turn yellow when they have acute liver disease. Not necessarily from alcohol, but if they get viral hepatitis, A, B, something like that. And that generally just all resolves. Any sort of take-home message, if you know yourself to be a little yellow, you should get yourself to the doctor just for an evaluation.
And are there other things that you would say, other things that people may notice that could be a sign of significant underlying liver disease that they should take as a trigger to be evaluated?
Yeah, so in addition to yellow, which is, not subtle, I think if people notice themselves to bleed easily, most commonly when people brush their teeth and see a lot more gum bleeding than they normally would. If they happen to notice that their hand size is increasing and they're not eating so much, all of a sudden they have to let out the belt and they're feeling a little bit of distension, that's something. If they find themselves to be a lot more forgetful or a lot more sleepy, or conversely not sleeping at all and developing a lot more insomnia, these are all things that could be related. Most of them are not, but I think, in the right clinical setting, someone says they're drinking 2 to 3 glasses of something a day and all of a sudden this happens, they've been doing it for years, it warrants it. But the frightening thing about liver disease is there usually aren't a lot of warning signs until it's very late in the disease.
So let's talk a little bit about treatment. Obviously, the cornerstone of treating alcoholic liver disease is to stop drinking. You've already said that a lot of folks will recover on their own. That's hopeful. Are there other kinds of treatment that you prescribe or are available for people to kind of accelerate the healing or make it more likely that they'll heal?
The simple answer to that is actually no. The only way the liver can improve and heal is to take away the stimulus, which is alcohol. What we do is we treat the complications of advanced alcohol-associated liver disease. So if someone has distended veins in the esophagus that are at risk of bleeding or have bled, we can give them medications such as a beta blocker to decrease pressures and prevent bleeding. If they've developed fluid in the belly, that's called ascites, we can give them water pills or diuretics, which help get rid of that fluid. If they have some episodes of confusion, there are medications we can give to help clear that. But those are all treating the complications and not treating the disease. At the end of the day, the only thing that will cure decompensated alcoholic liver disease is getting a new liver or transplant. And that's why we're seeing, because of the epidemic of alcoholic liver disease, the number of people being listed, being transplanted in the United States, going way up. And again, alcoholic liver disease is the number one reason why people in the U.S. get transplanted.
Yeah. Well, David, thank you so much for all of this. Can you recommend a place where our listeners can go for more information?
There are a lot of places, and I would just sort of caution that people go to respectable places to do this. They can go on the website that we have for Northwell and go to the Sandra Atlas Bass Center for Liver Diseases. They can go to the websites locally for the Empire Liver Foundation or nationally for the American Liver Foundation, and there's a lot of good information that they can get from those sites.
All right. Well, thanks so much for joining us today.
Ira, thank you so much for having me.
For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.